So hello guys, actually I was reading about the Lancet report, and it's like recent finding published that the Lancet Planet Health have unveiled the severity of the air pollution impact across the Indian cities. Actually, if you say just it is a tragedy, or you can say like it is a pre-estimated phenomenon which we are like trying to stop, but it's not in our hands. Actually, estimated like 33,000 annual deaths just across the 10 major cities because of the PM 2.5 exposure, and which are like WHO's guideline. Actually, we don't even focus, and the government is also maybe not taking the steps properly, and the vehicles, and because of like many industrial pollutions which really might cause the deaths, and these deaths will increase in the upcoming future, as you all know that if something is going to like ruin, then it will ruin as far as the time goes on. See, the Delhi suffers the highest burden of like 11.5 of percent of all deaths, like 12,000 per year attributed to PM 2.5. As we all know that the Delhi is like the most sufferable places in the world because of the environmental issues, and Shimla also. Actually, there's a pretty interesting thing now. The Shimla is in the mountain, but still it's having like deaths because of that. So it is a key alarming, harmful effect. And the one you're talking about, the apocalypse, actually it is about to come. And the Hyderabad records is like 5,552 annual. That's just a sparking. So these are the data like have been found, and the global context. In terms of the global context, like fossil fuel related air pollution that is have declined like 7%, means that it's a good news. By the way, heat related deaths due to the climate change have been rising 167, because here in India, and if I talk about like where I live, it's just usually gets around like 41 degrees Celsius and 42 degrees Celsius is pretty obvious in the mean run. But throughout the whole summers, and also the as far as I've seen like the because of the urbanization, it's also affecting. WHO's recommendation is PM 2.5 level not exceeded 50 mu chi, but in Indian standards is 60. It's just you are just feeding the poison, uh, but at the high level. So it's just kind of like maybe there is an irony that WHO is known for as an organization to provide the insightful outcome, but we uh, still do like just ignoring those outcomes of apocalypse, and maybe it will happen in the future, but let's see what the government can do. The recommendation is to like update the 2.5 standards to match the WHO's recommendation, which is really hard step that the government should take, and I request to the government to take as soon as possible, because if you don't take that, and 33,000 number would increase into 3 lakhs in no time. Maybe it's like an estimate procedure, but maybe it shall be, or it would be. By the way, like air pollution crisis is just like uh, can be less because of strengthening the clean air programs, just like cities beyond Delhi, and develop the heat health action. Actually, no, air pollution is a national public health emergency, and the time to act decisively, equitably, and urgently is now. Because if we don't take any step here, so this could be a problem. By the way, this could be a lot of problem, because in my opinion that the all of the countries who have like usually follow the WHO's guideline, they have the less they have the less death rate in terms of the environmental issues. But in India, like nobody's going to talk about this, because everybody's just focusing on to having like the the tussle between the social tussles and the economical tussles, and usually most of the time like the tussle related to the religion, and there are the other things, but they are really forgetting what is the real enemy, and what's the real demon is about to having to wait for them to just rise and shine. And